I hope you guys are doing fantastic today. I have a little visitor that is attached at my hip this afternoon. This is my dog Pearl, and she is going to be joining me on this live today. So today we are going to be talking about the difference between antibody testing for COVID-19 and diagnostic testing for COVID-19. There has been a lot of confusion in the news. There has been a lot of mismanaged marketing on different products, and so we're going to talk about the differences between the two, and also talk about Modoma is now offering antibody testing for our patients. So before we get started, you can go to modomamassage.com to take part in your introductory massage package. We'll get you completely connected and fill you in on all the information that you need. So today we're talking about COVID-19 diagnostic testing versus antibody testing. So you might be like, I've heard about the new antibody testing for COVID-19. What exactly is it? Is it the same as testing to diagnose COVID-19, or is it different? So with all of the talk about COVID-19 testing in the news, it's not surprising that there's confusion about the tests and how they differ. Antibody testing determines whether you have had COVID-19 in the past. So you have completed having the virus, and now your body would have the antibodies to fight against the virus. But to test to diagnose COVID-19 determines if you currently have the disease, which is known as a diagnostic test. So yes, like I said, before we get started, you can go to modomamassage.com to find out more information about antibody testing at any time. So the first thing I want to cover is when antibody testing is done and why it's so important. So antibody testing is done after full recovery from COVID-19. You can also do the antibody test if you've never had symptoms of COVID-19, but think you might have been exposed 2 weeks before or later. So many people are asymptomatic, meaning that you never showed symptoms, but you are wondering if you may have come in contact with the virus. You can get the antibody testing to show if you have been exposed. So it's important to know if you've had it in the past and have built immunities. The most important thing to know is that when you're taking the antibody test, that you are not showing current signs of COVID-19. That would be the diagnostic test and something else. So a healthcare professional takes a blood sample, which is usually a finger prick, and then the sample is tested to determine whether you've developed antibodies against the virus. The immune system produces these antibodies. They're proteins that are critical for fighting and clearing out the virus. So if test results show that you have the antibodies, it indicates that you were likely infected with COVID-19 at some time in the past. It may also mean that you have some immunity. So at this point, it's unknown whether having the antibodies means that you're protected against COVID-19, against reinfection, but the level of immunity and how long the immunity lasts are not known. But there are ongoing studies right now that are revealing more data on this. However, if you do end up showing that you have the antibodies, which are good, that means that if you are reinfected at a later point, you're going to be okay. That means your body has what it needs. The timing of the antibody tests are also pretty critical too. When the immune response is still building up in your body, the test may not detect the antibodies, so you may have to wait several days to get tested if you're showing symptoms. So the FDA has authorized and verified certain antibody tests, with many tests that with questionable accuracy that are now on the market. So we saw a lot of this in the news in the last week. There's a lot of mismarketing. There's a lot of at-home tests that are now being called back as not as accurate. So it's very important that you find a medical clinic to do your antibody testing like Modoma, so you receive a valid test. So another benefit of accurate antibody testing is that people who've recovered from COVID-19 may be eligible to donate plasma, a part of their blood. So Plasma could be used to treat others with severe disease and boost the ability to fight the virus. Doctors call this convalescent plasma. In the US, COVID-19 has expanded an access program that's recruiting participants from a treatment study, and has already been used in a lot of more severe cases on an experimental basis. Well, Pearl, what are you doing today? You want to lay down? You want to sit? She's a little bit extra. So the other type of testing we're going to go over now are the diagnostic tests, and there's two different types of diagnostic tests. So when you're having symptoms, when you're like, oh my goodness, do I have COVID-19? There's two different types of diagnostic tests that you may get. The first one is a molecular test. This test detects genetic material of the virus using a lab technique called a PCR test, where a healthcare worker collects fluid from your nasal cavity or throat swab from your saliva. Results may be available in minutes and analyzed on site. These tests, molecular tests, are considered very accurate when performed properly by a healthcare professional. Modoma does not do diagnostic testing at this time. The rapid test appears to be missed in some cases, but the FDA also has approved certain COVID-19 at-home test kits, but like I said, several of them have been recalled. So the FDA warns consumers about buying unapproved home tests because they may be inaccurate and unsafe. The other type of diagnostic test that may be done if you're experiencing symptoms is the antigen test. This is a newer COVID-19 test that detects certain proteins that are part of the virus. Using a nasal or a throat swab to get a fluid sample, antigen tests can produce results in minutes. Because these tests are faster and they're also less expensive than the molecular tests, some experts consider antigen tests more practical to use for large numbers of people. So a positive antigen test result is considered very accurate, but there is an increased chance of false negative results, meaning it's possible to be infected with the virus but have a negative antigen test result. So again, the molecular tests are more accurate. So depending on the situation, the doctor may recommend a molecular test to confirm a negative antigen test result, just depending on your symptoms. So what do you do if you're interested in a COVID-19 diagnostic test or an antibody test? Diagnostic test, if you're feeling symptoms, contact your doctor or other healthcare professional to discuss your situation, and they will point you in the right direction. If you are looking for an antibody test, again, a healthcare professional will be able to help you with this. Modoma is considered medical clinics. So we have access to these approved antibody testing kits that if you would like to know if you've had exposure to the virus in the past and now have antibodies, we're able to offer it. At this time, because of limited quantity, we're offering it to our patients. So if you would like to become a patient at Modoma, visit modomamassage.com to take part in your introductory massage package. We are so excited to be back open. Our reopening procedures and our cleanliness, all of the sanitization procedures and everything has just exceeded everyone's expectations and makes our customers feel very, very safe. So now is a great time to take part in an introductory massage package. Again, you can go to modomamassage.com to learn more about that and also the antibody testing. So guys, thank you so much. I hope you all have a wonderful day, and let us know if you need us. Thanks.